Welcome, everybody, to another episode of The Root of the Matter. I am your host, Dr. Rachaele Carver, and today I am over the moon with one of people who I consider to be one of my mentors. And when I'm looking to learn something new, I'm always on her podcast, The Spectrum of Health. Dr. Christine Schaffner, thank you so much for being here. She's an incredibly busy lady, so this is a big honor for all of us to have her with us today.
Thank you, Rachel. It's an honor to be here, and I just love to see everything that you've done and how you've expanded your vision for your vocation. And it's just been awesome to see you grow as well.
I think I first knew of you back in 2020 when I started listening to a lot of summits, and I think it was your conversation with Jay Davidson where I found about CellCore, and then we actually got to meet at CellCore's Eco. So we've been seeing each other now. We go yearly, and even though maybe we only see each other once a year, I just feel like we have a connection.
Yes.
You've helped me with so much, and not just my business, but my life and career and health stuff. She may be younger than me, guys, but she's really smart, and I consider her a mentor.
You're reverse aging because I think we're the same.
Let's hope so. Let's hope so. But Christine and I we share a kind of a love for knowledge and really wanting to create awareness about, we all want our patients to be their own best doctors. We want to partner with our patients, and we want to expose them to all these different avenues of health that exist today. In one aspect, we live in a world that's so toxic and really disease care, conventional nutrition. But on the upside, there's so many, really like the word alternative, but there are so many other great optimizing therapies that are out there that are available to us. And I had a hard time trying to think about what we were going to talk about because we could talk for 5 hours because Dr. Christine knows so much.
I love it. I know that we're going to have fun.
Let's maybe start with, I remember one of the first times I heard you talked about in your naturopathic training, you were actually introduced to the meth and you were taught about that, which is rare in conventional and even sometimes naturopathic training. So tell us a little bit about your first kind of introduction to the oral systemic connection and maybe how you incorporate that into maybe a new patient exam or an intake. How does that factor into a diagnosis?
Yeah, I had the conflict whether I would do the traditional path that was laid before me by my family and check off all the accolades that we're all striving for a young age, or take a leap of faith to become a naturopathic doctor. And so that journey really led me to Bastyr University, where I got my foundational training. And I remember at one of the brown bag lunches we had, and I really had in my heart that I didn't want to just do the surface kind of medicine. I really wanted to go deep and give people answers to really resolve these issues, because at the end of the day, I think why you and I are so passionate, and we share this, I think, shared value that you don't have your life if you don't have your health. I've seen people from all different bank account levels, all different places in their life. And health is the great equalizer. It is something that when you are in pain or you're in a state of disease, it takes you out of your, I think, purpose on some level and puts you into your root and survival. And while that could be part of your healing journey and part of your life purpose, many people unfortunately stay in that state and don't have the answers or the framework or the narrative that they can heal, and that their body is wise and intelligent and divine, and that there is this whole field of medicine that I think is only going to get even more awareness, especially over this next 20 years, that is available to them. And I just wanted to plant that seed. And then really, I went to this brown bag lunch, and Dr. Louisa Williams, who is one of the mentors of mine, she wrote a beautiful book, Radical Medicine, and it had just come out. And so she asked us in the brown bag lunch, she said, what is the first thing you do with a patient? And everyone, take them off gluten, do all the food allergy testing, so gut focus, which is important. But she said, you look in their mouth, and you look and you do a thorough dental history, because disease starts in the mouth, from her perspective. And I really do think that while conventional dentists are lovely people, unfortunately, they're trained in a very archaic system, in a very disease promoting systems. She really created this beautiful body of work and distilled it in radical medicine. And I used to carry that book around me. It was big. It was before the Kindle was out. And wherever I would go, it was just like osmosis. I just knew I wanted to know everything in that book. And my study and post year, really, I had other mentors that taught me bioregulatory regulatory medicine. And again, regulation is something that I think we forget often, even in naturopathic medicine or functional medicine, or many even root cause medicine. We forget to just start from that beginning point and that kind of laying the playing field. No matter how complex an illness is, we still go back to our roots and we trust that the body has this self regulatory capacity. And regulation, I think, is not only the autonomic nervous system, but believe it's also the fascia. And so they work together. And I think they're two sides of a coin of this regulatory tissue. And when we get into these disease states, there's something that is interfering or blocking or not allowing the self-regulatory capacity to be really liberated in these tissues. So when you think about the mouth, I ask my new patients for a dental history from basic to complex depending, but just a basic screening as would be history or current amalgam fillings, root canals, or any teeth extractions where there could be possibly a cavitation. There could be also other questions if they still have a current permanent retainer. Do they have braces? What is their jaw? What's their teeth grinding? What's their occlusion? Do they have sleep apnea? There's many other complexities, but the screening is those three questions. Hey, do you have amalgams currently or ever have them? Do you have root canals or have you had your wisdom teeth extracted or any other teeth extracted that potentially might have not healed as properly? So we dive into that and why all of those things are really important. As many of your audience knows, of course, each tooth not only is really in touch with the circulatory system that can go systemic, even conventional dentists and doctors know that anybody who has an infection in their mouth can affect their heart or systemic, but we don't put it together when we're thinking of a chronic illness, unfortunately, still in medicine. And so we know that there's that systemic relationship with circulation. And then I know you educate about the meridian system. So each tooth sits on a meridian, which can affect that organ system and be either a cause or a correlation with that system being ill. But I also think if you have toxicity or biotoxins or microbes, there are these highways in the body we don't often think about, and they can migrate through not only the circulatory system, but the lymphatic network that is all throughout the body that also is talking to and communicating with the nervous system. So if you get these microbes or these toxicants in the lymphatics, they can migrate into the nerves. And some of the nerves actually absorb these lipophilic toxicants that can affect actually nerve function or communication. We also can get these biotoxins, or we can get these different toxicant amalgam filling related metals that can be inhaled, and they can basically bathe the tonsils. They can bathe the whole gulch or gut associated lymphatic tissue, or even our coastal lymphatic tissue and the mucosal membranes in our sinuses. And then I've learned through dentists and biological or bioregulatory medicine that some of these toxicants actually through what we call retrograde axonal transport can be carried from the nerves that connect to the cranial nerves that connect to the brain. And then these are highways into the brain. So one of the very common symptoms of mercury toxicity is neurological symptoms. So people can have dementia to insomnia to anxiety, depression, brain fog, or anything in between the cognitive decline. And so I feel like this is old news that still has so much more awareness to share with this population, because all of the baby boomers who are getting ill right now or are going through the aging process, they have those conventional control practices that are still unfortunately happening, but less, especially with the amount of food. So that's a long, that's
It's
yeah.
fabulous. Interesting because there's been a lot of research lately showing how there was an article I read recently showing how that Porphyromonas gingivalis, which is one of those common oral bacteria that's considered a bad guy or red complex, that can activate the microglia in the
Yes.
brain, which is the microglia is what produces those plaques, which a lot of Alzheimer's meds have been trying to target that. But now we understand that those plaques are actually a protective mechanism for the insults of these bacteria and the bacterial toxin. That's pretty damning and pretty important why we need to take care of the mouth. I always say I'm so fortunate to be a dentist because I have such an accessible area to work on. I'm not trying to work on the brain or in the arteries. This, I shouldn't say easy, but compared to all the other specialties in medicine, I have good access to be able to rid the body of toxins and infections. I always, in all of my lectures, show the picture of all the nerves and the lymph and how they're all intimately connected, right? As you said, like 20% of our lymph in the head and neck, right? And we just recently, what's been about not even 10 years, right? Where we learned about the lymphatics and how if we're not sleeping well, right? So if we have sleep apnea or any issues there, we're not draining the brain for all those toxins that could be there. So trigeminal neuralgia is one of those tricky things that people are like, we don't know what to do about it. Do you think there's an infectious component perhaps from the mouth that causes that?
Unfortunately, I've seen people go through trigeminal neuralgia, like I'm sure you have, and it's one of the worst pains. They talk about it as like ice pick pain or this really debilitating pain that, again, takes them out of life. They can't sleep, they can't function, they have to rely on pain medication. And there's not a lot of answers. I'm hoping in our lifetime, Rachel, in my lifetime, that we can really get closer information to actually figure out what's living in that nerve tissue. However, I do believe I've seen it actually firsthand. I'm thinking of a patient in particular. When I saw her at first, she had many amalgam fillings and many root canals. And through our combined treatment with myself and a great dentist in town, she went through a removal of root canals and removal of her amalgams. And through chelation, I saw her trigeminal neuralgia go away. Again, it's not just one thing, but I do believe that if you have amalgams, mercury is probably the first offender to lay a terrain where there can be hosts. It can be a more hospitable host to either Lyme spirochetes or other spirochetes that are often in the mouth. Also viruses. So there's a lot of hepatic viruses that can live in the nerves that get activated when the immune system is not able to keep up with keeping those viruses dormant. So Lyme viruses. I think other infections could be secondary, creating inflammation, but I believe the heavy metals plus spirochetes and viruses are probably the biggest offenders. Yeah.
And now both of us really are big proponents of the neural therapy. And that's when I see the patient. My sister was probably one of the first I saw with the trigeminal neuralgia. She was like, it's this tooth. She kept pointing the tooth. And I was like, it's a virgin tooth. It never had a filling. Like, nothing wrong with the tooth. So I was like, at that time, I was like, ozone does everything. It's magic, And so I was like, well, let me just give you some ozone up there. And it was a little bit helpful, but it's still, then I actually taught her husband how to give her anesthetics for the area so she could take the pain down a little bit. Talk to us a little bit about what neural therapy is, why it can be helpful in certain situations.
Yeah, neural therapy is one of the most powerful tools in my toolkit that I use. I know many of us gravitate to different therapeutics. There's many passed around, but neural therapy is about an over 100-year-old technique that developed in Europe, specifically Germany. And these two brothers actually were finding that when they went to the root cause of a pathology-inducing syndrome, that if they basically used the anesthetic and created a lessening in pain or inflammation in either that nerve or that tooth or that area of the body, the whole body relaxed and that symptoms would go away. So what developed out of that is this use of procaine. So I know dentists are very familiar with Novocaine or procaine, but we compound it. It's preservative free, so it's going to be a cleaner form than the average dentists use. It's very readily broken down in the body into basically healthy metabolites the body can quickly get rid of. It has a short half-life, and so I have very sensitive patients. And most of my patients, I actually, knock on wood, I've seen even my most sensitive patients tolerate Neurotherapy, they might only be able to tolerate a little bit in the beginning. And then as we go through the healing journey and they become less sensitive over time, we can do more neurotherapy. So neurotherapy can be injected into ganglia. It can be injected into segmental patterns or scar tissue. So when we go back to those tissues of regulation, we think about the autonomic nervous system and the fascia. So I'll start with scar tissue because that's one of the things that levels the playing field. And when we inject a scar, so scars can be areas of injury from a surgery, from a trauma, from a mole removal, what have you. And the body is so intelligent that it heals that area, but it doesn't heal it in the same way that the original fascial fabric looks. So it's more denser, it's more irregular, it's going to be like a traffic jam in that tissue locally and systemically because the whole system works and communicates as a whole integrated system. And so when there is a compartmentalization or stagnation in the tissue, that can affect the whole system. And in that scar, Louisa Williams says it's an island of turbulence, meaning this traffic jam can be a net for toxicants, trauma through the fascial memory and pathogens because many co-infections or other self pathogens love the connective tissue. That's where it loves to hide. That's the cellular matrix or connected tissue. And so when we inject the scar, we're not only injecting the length of the scar, but we're also injecting underneath the scar to bring back fluidity, to help restore cellular voltage, to increase circulation and lymphatic drainage in the area, and to create less stagnation in that tissue. So often what people feel is like a lightening of the symptoms, that there was a big trauma, they feel environment, they can release that trauma from their tissues. And then just to get the crinkle in the saran wrap, right? Or if there's like kind of this area or this crinkle that kind of starts getting smoothed over the whole, there's not tension on the rest of the saran wrap. I see other symptoms improve, like pain patterns or autonomic symptoms improve. And the nerve fibers are communicating in the fascia. So it's happening in the environment in the fascia is important for the nerve fibers to send to the brain of the brain to send them into the surrounding tissue. So that's one kind of really fun, sweet one. And then I do a lot of segmental patterns. I've been training them more injections, but I just where I'm at, I feel it's a lot to segmental patterning and add with the principles of interstitial as well. So segmental patterning can be in areas around either the brain, the sinuses, the lymph, the tonsils, the thyroid, the lung, the liver, the spleen, the small intestine, the kidneys, and really anywhere that there is an organ and or a tissue that is in pain and or in pathology. And so what segmental patterning is we inject in the surface of the skin and we're working with nerve communication. So we're working with the cutaneal nerves or talking to the deeper nerves that are talking to the capillaries that can increase the flow of blood to an organ. So that is one area of why it works so well. I think there's another reason that we'll probably learn more about in our lifetime is that essentially the fluid of the protein also goes into a newly discovered organ. We're talking about two newly discovered organs in the last 10 years. Something that's called the interstitium. So under the skin, when we learn derm and dermatology in our histology classes, we learn that, okay, we have 7 layers of dermis. Underneath the 7 layers of the skin is the stacks of collagen, and then there's fat and other lymphatic tissues and so on. However, what we've learned in those stacks of collagen, because we're looking at dead tissue, not alive tissue, and that's what we didn't realize the lymphatic system until we could visualize the alive brain, that in that stacks of collagen, they're actually these vacuoles of fluid. And so what happens is that when we go into the skin, before we even get to the blood supply or before those nerves get to the capillaries, we get into those fluid vacuoles that can actually deliver through this whole body wide network of the interstitium that actually communicates with the lymph. I think there is some movement of fluid that gets trapped or stuck in the interstitium when people are sick. And so I think the propane is also not only opening up blood flow to the liver or the kidneys so it can function better and move energy in that organ system, but I think we're also moving the interstitium and alleviating stagnation in the interstitium. And that's why I think people feel good as well.
Yeah, I agree with you. It's one of my favorite things that I ever learned because the therapy is so profound. It's absolutely amazing how people feel so much better so
Yes.
quickly with really no side
Yeah.
effects, no contraindications. Like it's just absolutely incredible. Patients who have been, on steroids and all these things to try to get rid of this pain, and then you give them a 1 cc of
I
just
know.
some procaine, and it's like,
I
"Gotcha."
know, totally. I call it acupuncture on steroids. I love acupuncture and I go to it regularly. But especially for the trigeminal nerve, you can do a sinus pattern to help alleviate pain in the trigeminal nerve where you're doing a bunch of acupuncture points that follow the trigeminal nerve. You can do the sphenopalatine ganglion or the otic ganglion or even the tonsils or just the lymphatics or the vagus nerve. I get a lot of results with just the sinus pattern and maybe the tonsils to help alleviate pain in the head.
Yeah, it's great. I was just going to circle back to
Yeah.
the tonsils because that's a
Yeah.
big one. We see it is not the most fun injection to get, but it's pretty profound what I have a patient who's been coming to me just for that.
Yeah.
And the poor thing, is going through so much. She's been labeled with chronic fatigue and fibromyalgia and all those syndromes that we don't really know what's wrong with you. And that's having such an effect on her skin even, right? She's breaking out and all these things. She's have that long hauler
Yeah.
syndrome type of thing. That's what she claims. Like ever since the shot, she's just never been the
Yeah.
same. And it's amazing how the tonsils are a major area of immune tissue, right? And lymph tissue. And like you said, that's all connected to the whole
Yeah.
body. And so it's fascinating when you can drain that. And the cool thing about neural therapy, again, it's not like a steroid, right? We're not trying to stop a body's reaction. We are stimulating the body to do what it's
Yeah.
meant to do, right? This is that idea. What we mean by this bioregulatory is we are trying to give the body a hands up and say, hey, remember how to do this. We need a little support because it's being so bogged down by inflammation or infection or toxins, whatever it is. And that's why there are really no side
Yeah.
effects. And that's why most people can tolerate it because, again, we're stimulating the body to do what it's supposed to do by basically injecting energy. Both you and I are big energy
Yeah.
people, big believers in the quantum and how all this interacts, and that it's really important to understand that it's this energy that underlies the biochemistry. Conventional medicine dentistry, it's all about the biochemistry. But what allows that chemistry to work is the energy behind it. And when we are sick and we have pain, when I see pain, I'm thinking, why isn't the energy flowing? And so that's basically like you were talking about with a scar. This is an area where energy is interrupted, right? There's an earthquake and the road suddenly is broken and now we can't get over the broken pavement, right? And so the idea of the procaine is to reconnect, improve that pavement, make it smooth again so that energy can flow back and forth and make sure that fascia can move and supply all the nutrients that the underlying tissues need. It's amazing. I think it works great for TMJ issues. There's often so much inflammation there. And I like to sometimes combine it with some homeopathics to help the lymph drain a little bit more. But it seems once you reduce that inflammation, the body can heal itself. But if you've got this chronic inflammation, the body is just always on high alert and we have problems, and it's hard to get better when you're just in that constant state of inflammation. So, I'm a big fan of the neural therapy. I really wish more people would understand it. We teach more about it.
I think that will happen. I think, I think it's our time. We have wonderful colleagues, Dr. Ann Hell and her partner, Dr. Alana.
Yeah, I had Ann on the podcast, so she told me we did one whole podcast solely about neural therapy. But I want to get your perspective because I know you've been doing it for so long.
I love her. I love it. Yeah, passing the torch. Yeah.
Yep, exactly. We have this great network of people who know all these wonderful things. So I just had an endodontist on who was really interesting because in the biologic world, bioregulatory, we see a lot of things where, root canals are bad. And her comment, if it's done, we can try to at least buy us time with the teeth. And I think it's an important avenue. But most of the time, as we discussed, that most people who are doing these root canals aren't properly trained. They're not using the technology. We're not fully cleaning this
Yeah.
out. And that's what leads to residual infection. And now most of the nerve is removed, so people don't feel anything. But like in your situation, that's one of the first things you ask, are there root canals? So tell us a little bit about, as a medical naturopathic doctor, when you're looking at overall health, because she couldn't really answer the question. I was asking, how do you see this related to overall health? And she
Yeah.
she doesn't
Yeah.
know. As the medical doctor, what are you seeing sometimes that maybe a poorly done, improperly clean root canal, how did that affect
Yeah,
someone?
no, and I am so glad you're talking about this. And ultimately, root canals are dead teeth. I'm really open. I know it's becoming more popular to do like a healthy root canal, which I think can buy people time. That's all, kind of what we're trying to do, because it's a lot to consider to remove a tooth, especially depending on where it is, what else is going on in the mouth, who they have locally to do a good job to extract the tooth, and think of a long-term plan. And the pain is real. Like when people are going through a dying tooth, there can be like a really severe pain. Ultimately, I do stand by my knowledge, and I'm always happy to be swayed differently as technology gets better, that a root canal is a dead tooth, and we don't ideally keep dead matter in our mouth, because what in traditional, we'll just talk traditional, then obviously you have this wonderful endodontist who's doing it a different way. Often in a traditional root canal, there's a dying tooth. They take out the nerve. They stuff non-biocompatible material, often metals, and different resins that are not biocompatible, and seal off the tooth. No ozone, no antimicrobials, and they say, okay, we took that dead tooth and we sterilized it in a way that it's going to be fine. And there are many people who have debunked that thought. And from my just observation, I just clinically observing people, root canals are a chronic poisoning of the body. So it's basically a chronic poisoning of the toxicity from what's inside the tooth. Again, it's over time getting in the circulation, it's getting into the lymph, it's getting into the nerves. We're inhaling it, we're affecting our sinuses and our tonsils, we're affecting our gut. Many chronic SIBO issues or chronic gut issues begin in the mouth, in the sinuses, and the tonsils. Essentially, what happens to that root canal over time? What I learned is that the root canal can basically start producing mercaptans and thioethers that are biotoxins that take up a lot of our sulfur containing mechanisms or pathways to essentially detoxify. And when we deplete the body of sulfur, we cannot basically remove other toxicants as well. A lot of our detox agents are what we call sulfhydrylaffinitive, binding either metals or these biotoxins to get out of the body. One of the things we do to help mitigate root canals is give the body flooded with MSM. Some people say they have a sulfur sensitivity. We have sulfur in every cell of our body. And yes, I think there are people who don't process sulfite or sulfates well, but I don't think we truly have an allergy. That means I think there's a big toxicity component. There's this sulfur depletion in the body, there's the thioethers and the mercaptans. And then they found over time that bacteria, okay, this is not a sterile tooth. This is in an environment. We always think that things are nicely compartmentalized in the body. Here's the nervous system, here's the lymphatic system, here's the circulatory system, here's another tooth. But what's happening in this root canal, the other tooth, if they're having any issues, any gingivitis, any periodontal disease, any oral kind of imbalances of microbes, you look at the oral health all the time. Many of us have just an imbalance in our microbes in our teeth, and that can over time migrate. And again, that doesn't have a healthy living environment to help clear and change that over time. So those microbes can get embedded in that dentin, and then there can be like a little thriving community of microbes that the body can't resolve. And then again, that can be chronically poisoning lymphatic, nerve, the gut, the mucosal surfaces of the body. And these are the people who do everything to maintain their health, do all the lymphatic work, every supplement, and they don't go hard. And that's when we look at these interference fields, right? We look at these things for interfering with our body's ability to self-regulate.
Yeah, and I have this theory because I'm big in the energy world too, that, okay, because it's dead, right, there's no more blood supply there anymore, that I almost feel like when we think about frequency, right, everything in life is
Yeah.
energy, right, and we are just dense
Yeah.
energy that looks like matter, right, but we're really just energy. So I'd say in that area where there's less blood supply, the frequency of that terrain, I think, and it can almost attract those spirochetes and
Yeah.
fungus and whatever it is, they can go live there happily because there's no more blood supply, right? So the immune systems can't really see them and deal with it. And so it's almost like they migrate to an area of this low frequency
Yeah.
and can sit and create problems. That's why I like things like ozone and neural therapy, because I'm like, let's put energy in it. The more energy, the healthier we are. A lot of us who are chronically ill, our overall body energy is very high because all of us could be sick, but those of us who are able to produce more energy, have more energy, even if we eat a fungus or we have parasites, if our energy level is high enough and our body can regulate itself and remove those toxins. It's when we get so bogged down that our energy, in my opinion anyway, that our energy is so low that we're just in this chronic state of infection, right? So that's why I'm always thinking, how do I, yes, I can try to give you antimicrobial this and do this and that, but how do I also then get the energy high enough so it doesn't come back, right? How do we get you out of that chronic state?
Yeah. And that's where Dr. Tennant, right? He wrote a book, Healing is Voltage, and I got to see him before I became a naturopath at UVA. He was at our complementary and alternative medicine class in the School of Nursing that was run by a naturopathic doctor in like 2002. And he told us about his story of chronic illness. And he was in bed for 13 years because he got viruses in his eyes during the first LASIK surgeries, and that went to his brain. And so he had this kind of myalgic encephalitis that he was bedbound. Okay, and here's this high functioning, amazing person bedbound by this illness, and he tried everything, and he finally put it together that he found the scalar equipment that again became the tenant biomodulator in his community. That it was based on charge, and I will never forget that conversation that he said. He said that my immune system could not see the charge of the bugs. And so the skein are reminded, like there's, when we talk about frequency, here we are in the age of Aquarius now. Pluto's in Aquarius as we speak. So this is going to be a 20-year paradigm shift where we're going to be talking about frequency, electromagnetism, light, sound, vibration, interconnection, that we're around this. We're all interconnected with this field of energy. And the more we observe it and participate in it, the more we can co-create with it. And when we think about the quantum piece of our terrain or the quantum terrain, we come from an energy field. Not only do we emanate and generate and have this bidirectional communication from the field, but we come from a field of energy. And really, where we both contemplate, I know, are these people, are these different pioneers. Dispenza says to change matter with matter takes time, but when you change the field, you change matter. And so when we can change these high level distorted patterns in the fields of our communication, that we can have an easier time changing the biochemistry. So what does that mean? I think distorted patterns in the field can be ancestral trauma. I think they can be just current life trauma. I think it could be anything that blocks us from our higher self or our higher knowing. So that could be the toxicity, the pathogens. Life, as you said, is everything has a signature frequency and also a basically signature, and vibrations actually create patterns in mediums like water or other mediums. And these vibrations create either patterns that are coherent or distorted. So that top level information of either a coherent pattern or distorted pattern will tell our cells either to create healthy, mitochondria, create healthy energy, create healthy epigenetic translation, or it's going to create distorted or dysregulated patterns that are not promoting our highest potential, but are going to be patterns that perpetuate illness in our ancestry or in our lineage. It's esoteric to a lot of people, but I'm beginning to talk about these things with very tangible science. In my downtime, I read quantum physics papers, and I try to educate and do different events around this, because there is so much body of work around this. It's just up to us, I think, as clinicians, to educate and also integrate. Okay, we still live in a 3D body. We definitely have this experience as being human, but how can we expand upon, and how can we rewrite all of our stories and our journeys so that we can actually change our epigenetic environment? And I think ultimately all of our cells are not only possible, we're this is a possibility for all of us, but there's also, we're all interconnected, whether we believe it or observe it or want to look at that or not. There is a part of us and every atom of our cell that is connected to this greater field of energy. So it's just, my mind just goes in all these different directions with this. And I'm trying to create a narrative and a model for my own knowledge base so that I can bring it to more people in my community, so we can just keep on refining it and finding tools. And ultimately, it's going to create better results. So that's why we're all motivated to do this. Who wouldn't want to practice where we just see people for a year rather than chronic illness? It could, I have lifelong patients like that, are just, these are long-term relationships, not because they don't get better in a certain period of time, but because life is so stressful. And if we don't maintain our health with all these tools, we can get knocked down, right? And so, yeah, it's just it's a passion of both of ours, and I think we're both really in this state of contemplation. But I know in my heart that we're in the midst of creating this new model of medicine.
I totally agree, and we've talked to a bunch of times on the podcast too about this, the emotional, those kind of traumas, and I see the longer I practice now, I have now patients are calling because I'm out there and about, and patients coming from far away will do Zoom consults, and they'll tell me the story. They've been to a million people, right? You have these same patients, right? And the story is so long, and they've done everything, right, in quotes. And first question is always, what are the stresses in your life? What is the emotional component? Because to me, you can do all the right things, right? But if you're in that discoherence or whatever, and you can put all the vitamins and supplements and all the exercise and stuff in there, but until we get that coherence, we can't get past the finish line, basically. Both of us are fans of the Nest Health system, because one of the ways, again, the technology is exploding. I cannot wait for their little new device to come out. That one, the wearable. Yeah. That sounds amazing. I keep calling them like, when is it coming out? When
is it coming? Hard on getting all that out to market.
Yeah. This is one way. How do we measure, right? So let's say, okay, yeah, maybe there are all these emotional traumas, or maybe, and sometimes even maybe you had a parasite 10 years ago, and maybe the physical parasite's not in there, but there can still be that energetic component in the train that's creating that, what was the word you used? Not discoherent, but
yeah, there's
fragmented or whatever the problem, right? And talk to us a little bit about what the Nest Health is. There are other things, like Dr. Tennant's biomodulator, I think is very similar to the My Health and Nest Health. There's similar technologies, came from the same thing, but how do you use that?
We all get asked, like, how do we put this all together? And at this current time in my life, I say, when I treat people, and this is not linear, but it's like regulation, drainage, resonance, coherence, and regeneration. And resonance and coherence are these kind of principles of, I use bioresonance tools, and I use this concept of resonance when there is a frequency match between two basically signatures of frequencies, there can be an exchange of information, right? So when we're thinking about all of this information, all these chronically ill people have, and how do we distill it in a 75-minute appointment to this, so that we can actually move them forward and create momentum in their life? And I rely, and I think there are going to be many more tools out there in this 20-year period, but I rely not only on my clinical pattern recognition, my clinical history taking, my intuition, but I rely on bioresonance tools that basically have this, not the body or stressors in the body, that there is a frequency signature. So there is basically the scanning of the body by connecting the body with either the device in person or through quantum entanglement through the voice, that we can basically detect, is there a frequency match that are you in resonance with yourself? Or are you in resonance with something that is distorting your health? And then looking at the pattern, right? It's not diagnostic, but it gives us a whole screening of where there could be emotions or meridians that are blocked, or areas in the body, the atlas that is out of balance and we need to bring a healing through an adjustment. And I also use the AO scan, so it can help us a little bit identify like different microbes that could be more prioritized. And so we take all that information and then I talk with the body and communicate with the body through muscle testing. So we're actually just opening ourselves up to both of our intuitions, the greater field of energy that we're all surrounded in with the intention to help that person. And then we're communicating with the body to see what brings healing and ease, what creates a parasympathetic response versus a stress response. And then we bring all this information to a treatment plan, which then that is going to be the next step on a journey of unwinding and a nonlinear process of healing. And I really don't know how I would practice without these tools. I look at lab work all the time, and lab work is helpful. You can get really good at looking at the signatures of lab work and seeing where people could be having issues, but it is actually doesn't give us the full story. And that's why there's so many people who go to the medical system. They don't look as sick as they feel. They go get lab work and they're told there's nothing wrong with them. And that's where we come into the picture.
Absolutely. And that's what I love because so with these kind of screening tools, we're able to see, hey, like you said, there's some resonance issues there and things like homeopathics. And now there's so much between light and sound. There's a million apps out there. One of my favorites is Meditative Mind, and it has so many different categories. Okay, I feel like removing toxins right now, or I want to feel abundant, or whatever it is, all these different frequencies. And I love, there's a video somewhere online that shows all these metronomes, maybe like 20 metronomes, right? And they start them all at different times. And with a matter of, I don't know what it is, 30 minutes or whatever, they all start going at the exact same pace. And that's the kind of idea of energy. And what that's how homeopathics and all these modalities work is we put in the frequency and then all that frequency goes through the terrain, hopefully, and then we all start resonating the same. Again, these seem woo weird concepts. This has been around for a millennium. We're just now trying to understand. We're now able to measure these things, which is cool. And it's just going to, the pace at which we're starting to understand all this energy is so enormous that the potentials for really healing are, I can't count them, can't even put it into words because it's exciting.
Yeah,
so in the last few minutes,
there's a
yeah, I want you to tell us a little bit about light and sound and how you use those to help people heal.
I really think this is the future of medicine. We are wired to communicate internally with light and sound. We have endogenous chromophores and we have endogenous ways that we communicate with sound that we receive and the sound and light that we generate in the body. And we know that our cells, our mitochondria, our microtubule, and our fascia communicate. They're the kind of the highway communicate these different kind of vibrations that our DNA also emits biophotons. So our DNA, our mitochondria emit biophotons that get sent through the microtubule and the fascia, what we call the living matrix in some circles, and that our DNA and our every part of our body actually a vibratory sound. So this is called sound psychology. So when we look at sound from the sound either can be singing a coherent, harmonic, beautiful sound that creates a pattern, can be coherent, so be regulated and powerful, or it's going to be distorted, right? It's going to be deformed from screeching, it's going to be diseased, crown functions like he essentially was the guy who discovered this. And cancer cells have the screeching sound and healthy cells have the perfect sound. So that alone is fascinating, right? And then we've also studied the fascial sounds. I've read papers about that. And then essentially our mitochondria receives light. So we generate and we receive. There's this kind of highway of communication in the body. And this is the work of also Fritz Albert Popp. So, okay, we talked about sound. You're either coherent or decoherent or dissonant, not coherent, not part of the whole, or not synchronized, not aligned, not integrated, right? Or there is this idea of Fritz Albert Popp who talks about coherent biophoton emissions. Basically, a laser is a coherent light emission. And we have that in our cells. So when we have in the cell like this Goldilocks amount of light, this coherent amount of light emission, that's a summation of the DNA that's getting carried from the microtubulin to the mitochondria, creating energy that's producing biophotons that's getting transported and emitted outside of the cell that's integrated within the cell. That it could either be an illumination of coherent light that's serving as a signaling and communication, or it is dissonant and decoherent, and that's going to be disease promoting. Or you could be too much light, and that could be also a sign of disease. That's what he found. So we still have a lot to discover, clearly, but these are really amazing pioneers that have gotten us on this path about how we can contemplate. We also have this beautiful water matrix within our body that also is a medium for these quantum particles that traverse within the body. And then this idea of coherence, I said. So I feel like part of our job is to help the body achieve this coherence, right? And this person to be in coherence with their higher self. And I think there's a lot of things that distort us from our natural coherence. And that's what we talked about a lot in this podcast. And when people are really sick, they have a hard time generating their own coherence through meditation. And so we add coherent information to their body through group prayer or group intention, through light, through sound, and reminding them to remember themselves. So whether you're getting coherent sounds on YouTube, or you're doing a sound bath in person, or doing the AO inner voice, or you're doing mantras or tones, sound is everywhere. It's available. And find sound that makes you feel good. And that's usually a sound that a sign you're in coherence. The sun is always giving us coherence with light. There is the full spectrum of light emitted from the sun that our body uses in all sorts of ways. So we all have access to that. And then we use lasers in our office to help remind the body of coherent light and to get coherent light traversing through the networks in the body so it can help to communicate on a cellular level for more health in the body. We use the Sound of Soul, on which Kelly gave us an introduction to Erasmus, and we can remind people of their own inner music from their heart, and that is profoundly regulatory for us. So again, the list is endless, and the possibilities are endless in this field, and we're just getting started. I feel like I know a drop of information in this realm, and I'm very excited. I think in this 20 years of paradigm shift, we're going to really get this elegant path to healing that we all seek for.
Yeah, I think it's so exciting with my introduction of laser and now red light. That's everybody's heard of red light therapy and near infrared, right? That whole industry has exploded. But as you said, there's green light, there's yellow light, there's blue light, there's this whole other lights that kind of do other things, and we don't have the time to get into it now. But these are the technologies that are really developing and cool. You can even put light intravenously. What? That sounds crazy, but again, every cell kind of communicates with light. This is one of the reasons why having sunlight every day is so important, because in that full spectrum, you are getting all those different colors and they all affect us differently and so important. Why do we get seasonal depression, right? When we have less sunlight, it does. It affects all of us profoundly. And what's so great is light is non-invasive, but it doesn't hurt. So when we can harness the power of these, same with sound, right? Anybody can listen to sound. I'm a big fan of Qigong. Yeah. And a lot of those therapies, we're using the sounds. Every organ has a specific sound. So when you're using, I notice sometimes that at work, I just had an interview about, we're talking about breath work. I'm over breathing at work. I'm stressed out and I'm sighing a lot. And I'm always giving that heart sound. I'm like, that's the heart. It needs like a release of all these other people's energy I've been absorbing all day, right? Or the sh sound is the liver, right? And how do we calm children, right? With that sh sound, because liver is where we get a lot of irritability, right? Anxiety, all that kind of stuff. So it's just fascinating. Again, these things have been around for millennia, practically, right? All these kind of things, and it's accessible. I know we could again go on, and I appreciate all your time this morning. So maybe share like how we can get in touch with you. Tell us about your podcast, how we can, because it's my go-to when I want to learn all sorts of good things. I texted Christine the other day. I said, I love that last episode. I'm going to go get that breast imaging that you talked about. That's so cool.
Thank you. Thank you so much, Rachel. I love learning like you do. And I just am a voracious kind of learner, and I love to allow people to share their knowledge on my platform, and I learn and I bring it into my practice right away. So we're trying to increase that feedback loop of getting the knowledge and integrating it right away. You can find me at the Spectrum of Health or Dr. Christine Schaffner. My clinic is called Immanence Health, which means the divine within. And we are based in Seattle, but we do telemedicine worldwide. And Catherine Clinton and I in 2025 are going to have a masterclass on the topic of quantum physics and this new medicine. So I hope that you all enjoy that. And yeah, Rachel, thank you so much for having me. I love your work. I love your mission. And I just so enjoyed being with you. So thank you.
I couldn't do it with great collaborators without you. And you also have some great skin products and lymph stuff. So I'm sure there's linked all that good stuff, the apothecary, right, with an eye. So please check out all of Dr. Christine's work. I don't know how she fits it all in a day, but people say the same to me too. But when you're passionate about something, there's always time for that. Again, thank you so much for taking time out of your very busy schedule. And I just adore you. And I am so excited to call you my friend and colleague. And I hope you have a fabulous day. Everybody, I hope you really enjoyed this episode. And please check out her podcast, her website, all the great stuff that Dr. Christine is doing. She's on that cutting edge of all this wonderful therapy that really gets to the root and really helps with feelings. Have a wonderful day, everybody. And we'll see you on the next one.